Of the nation tonight, medical interns across Uganda say they are trapped in uncertainty, facing delayed deployment, unpaid or reduced allowances, and harsh working conditions that threaten both their welfare and patient care. As tensions rise between interns and the government over funding and policy gaps. Now tonight, we speak to the president of the Federation of Uganda Medical Interns, Dr. Jacob Mwandha, on what interns are demanding, what is at stake for the healthcare system, and whether a lasting solution is in sight. Good evening to you, Doctor, and thank you for joining us.
Good evening, Mildred. Thank you for hosting me.
Well, let us start with you painting for us a picture of how the situation is right now, is particularly regarding the deployment of the interns, the allowances, and the working conditions all at large.
Thank you so much. First of all, the deployment, we thank government. All interns were deployed, and there is no backlog. But as far as we are concerned, with the care that we have received, has not all been that the best. We have seen ministry discriminating between interns, paying others and leaving others. And yet at the beginning of all, we all sign the same contract, that all interns have to be paid allowances for the services they are going to offer. For clarity, interns are no longer students. We are people who have finished 6-year courses, 5-year courses. We have passed, we have graduated. We are just doing internship as a 1-year mandatory program to be licensed, to become permanent practitioners. So we are no longer students. And all the services we offer, some are perfect and some we do under supervision by our supervisors, so that we, at the end of the year, we offer services like they can offer them on our own.
But the issues that you are raising, these are issues that have not only come up now. They have been over the years, if you're to track back behind the records. And so one would wonder why the recurring same issues, despite the efforts that you put in to talk to the responsible authorities, the Ministry of Health, the government. You even reached ahead to seek for the attention of the Fountain of Honor.
I believe we have had, I cannot call it poor planning, but it is poor prioritization. Because the same problem in and out. And one of the things that is making us put down tools now is that we have to be sure that the ministry is giving us an internship policy, which internship policy will give us permanent solutions to these solutions that we are facing. Our predecessors have fought for allowances, telling government the 1 million they are giving them is not enough. And it has been a song. With the cost of living, this is where you are getting interns now living in kiosks. As I talked yesterday, but we had an intern attacked in Jinja when he was going back home from work.
Because of where he is living? Because
of where he is living. And the allowance is so small, there is no money for board, so he had to foot. That's where thieves attacked him. And he's admitted. And to make matters worse, these boys and ladies cannot afford the cost of treatment that they had to receive. So this is where we come in, and we have been in engagements with government for the last 2 months. But I can assure you the progress has been so slow. And you see that these people are not interested in listening or answering any of our queries.
You have mentioned that the internship policy that you are pushing for is what is going to address all the problems that the interns are raising. And if you don't mind, take us through what is it exactly that is in this internship policy that you believe will actually make you return back to work?
Thank you so much. First of all, it is too big. We can't summarize all of it today. But I want to pick for you key points that I believe have been raising in and out and can settle this storm. One is the allowances, the amount of money an intern is supposed to get. The president directed clearly, you must have also broadcasted it here at one point, that each intern should be paid 2.5 million, which is half of the money a senior doctor gets. And as we talk now, they are paying 1 million. How and where did it change from 2.5 to 1 million? No one can explain. But if we pass this policy, and it is an act of parliament, and we know in and out, an intern has to work these specific working hours, then this business of people working 36 hours will stop. Because as I talk of now, you can go and do it as an intern at 8 a.m., you are on call at night, you continue up to 8 a.m. tomorrow, you hand over, you make a report in the morning, then from there you go back to ward round. up to 5 p.m. in the evening. This has been going on for long. People have complained, but nothing has been done. So this time round we are requesting, let us have a policy put in place, because we are civil servants. Although we may not be employed directly by government, but we are under government care. If they are saying a normal civil servant should work 8 hours a day, 5 days a week, why should an intern work 36-hour duty? So these are some things that we hope the policy will address. Who is an intern? For how long should he do internship? And how much should he get as an allowance? So that we stop this business of somebody waking up from her bed today and she changes the internship allowance from the current even 1 million even to 500. At one point I'd even say they should not give anything. So these are things we are seeing are unfair, but as of the current status quo of separating others, discrimination that has been put on, and we are saying this can't happen.
Well, Doctor, there is a saying that when two elephants fight, it is the grass that suffers. And in this case, it is the patient that is suffering. I mean, if you lay down your tools and as a doctor, you are called to serve. So where does this leave the patient?
Well, first of all, we are a committed group of people. And the life of our patients matter. And in our sit down that we are doing, that's why you are not hearing a lot of noise, because we are covering all emergencies. We are covering anything that threatens a patient's life in a short period of time. That's why we have not made so much news. But I can assure you, if nothing is done, we are withdrawing emergencies. That one I can assure you.
As it is, are you working fully?
As it is, we are covering emergencies fully. Be it day, be it night. There is no emergency that goes uncovered. When you say emergency, what are we talking about? Emergencies, we are talking about conditions that can cause a patient to lose life in a short period of time. These are services that are offered in intensive care units. These are emergencies that are offered at accident and emergencies. And these are services that are offered, for example, in obstetrics, where a mother is bleeding, or a mother has to go for an emergency cesarean section. Those ones we are offering. But if nothing is done, a hungry, stressed, defranchised, and angry intern or doctor is a threat to himself and to his patients. And this is why we are saying, instead of people continuing to work in such situations, they would rather first put tools down and government answers our questions. But, well, government has always come out to say that there are no resources. The resources are very limited. And they ask for your patience that your concerns cannot all be addressed at once. Why don't you listen to what they're saying and be patient? Thank you so much. They cannot all be answered at once. What have they started with? Well, if they are answering some, where is their plan? Let them tell us. It is not our role to look for resources. Our role is to look after the patients. It is not our role to look for resources. This is why we are saying we can't write letters. We can't send delegates over 15 times to your offices and you refuse to give us an answer. That's unfair. That's unfair. And we are saying, because of the life of our patients, and we love our government, we don't want to tarnish its name, we shall keep offering emergency services. We have now been off Monday, we are making a week. What would you suggest if it is you and you have gone for a week and still you have not gotten answers? So I think for everyone, like we started even in history, there is loss of life, there is loss of property, there is loss of... I think there should be sacrifices, but which we don't want to make. That's why we are begging government. This is something so simple. An allowance has never been a salary. This is an allowance. And every civil servant gets an allowance for as long as he's out of office and is doing work that is beyond what he's supposed to be doing. So now let us look at the way forward. How then do we move forward? Because at the end of the day, the intern has to get what rightly belongs to them, what the rewards for their work. But also on the other hand, there is the part of service, but also to the patient who is the end user of your services. So what then should the government do for you as the interns, your non-negotiables going forward, if they want you to return back to office? Our non-negotiables, number one, pay all interns. And SHOs, by the way, we are not only interns who have been denied this pay. There is also a category of senior house officers and refugees who have been denied this pay, but we work together and we work as a team. And you know, once you are in a team and some of the team members are defranchised or they have low mood, teamwork will be affected. So immediate effect is pay all interns and SHOs as per the contracts, because we have contracts that bind this. So ministry is breaching the contract. Let them honor the, and this, let me tell you now, the better part of this is that we had 1 day orientation from 8 a.m. up to around 5 p.m. No one talked about this, that they will not pay interns. No one gave a 3 months notice that is constitutional, that will say that is constitutional to be alerted that you will not be paid. No, completely nothing. But this was abrupt. So mid-term, I'm still giving you the way forward. Mid-term, let us reinstate the presidential directive, because even those getting the 1 million, the cost of living is too high, the money is not enough. And like one already was almost survived death in Jinja, no one knows what will happen to the other next. Then long-term, we need a permanent policy. This parliament should think through, ministry should think through, but especially parliament, this should be binding, so that we stop these things that are really oppressing people under there, and they keep shouting year in, year out. As we conclude, what would be your closing remarks as we conclude? My closing remarks, I would like to encourage all interns and assure you, be calm, and the SHOs, be calm. We are very sure that we shall get answers. But if we don't get the answers by next week, I personally, I will not come back to hold down an IA when they don't have answers. I will come back and we shall decide what to do. We love this government. This is our government. We don't want to tarnish its name, but again, we want to live. Okay. All right. Thank you, Dr. Jacob Mwandha. He is the president of the Federation of the Uganda Medical Interns, getting to give us their standpoint as the interns because of the issues that they are currently facing. And it is not just the first time. This has been recurring for the years. And we hope that a permanent solution can be accorded to them, because at the end of the day, when they are not in service, it is the patient, the last end user of their service, that gets to suffer. Well, that being said,